Good evening to everybody. So we'll start today's discussion. Our today's topic is deep brain stimulation in neurological diseases. So first we'll discuss what is deep brain stimulation. Deep brain stimulation means electrical stimulation of specific nerve cells of brain in different neurological diseases by a surgically implanted device which is called pacemaker. So sometimes it is called brain pacemaker also. I will show you a device. So this is the device. This is called pacemaker, which is implanted in the chest wall, anterior chest wall, in front of the chest wall, just below the collarbone, clavicle. And from this device, a wire is connected to the specific brain cells. So this is the pacemaker, and by wire, the specific brain cells has been stimulated. This is called deep brain stimulator. Now there are some neurological diseases like Parkinsonism, dystonia, some cases of epilepsy, obsessive compulsive disorder, essential tremor. So these are the cases where we use this deep brain stimulation when these diseases cannot be controlled medically, with medicine cannot be controlled, or medically resistant, the cases which doesn't respond to medicine. These are the cases which are the selected for deep brain stimulations. So these are the neurological diseases: dystonia, essential tremor, Parkinsonism, obsessive compulsive disorder, epilepsy. These are the cases. There are some other indications also, but these are the common indications. Now we have to know who are the cases, who are the patients who will need this deep brain stimulation. Not all the cases of Parkinson's disease or dystonia or epilepsy, they will need deep brain stimulation. So some patients, we select the patients depending on the type of the disease, clinical setting, patient's age, comorbidities, whether any other diseases or not. What are the types of the disease, whether it is responsive to medicine or not. All these criteria are important to select the patients for deep brain stimulation. Now this device, what I showed you, a pacemaker, this whole device has 4 components. One is pacemaker, which is implanted in the anterior chest wall, just below the clavicle, and by subcutaneous tunneling under the skin, the wire will be connected to the brain cells. This brain nerve cells, it depends on for what disease we are doing the DBS. The nerve cells differs. Just like for Parkinson's disease, we stimulate subthalamic nucleus. There is a nerve which is called subthalamic nucleus. For dystonia, we stimulate globus pallidus internus. For essential tremor, we stimulate VIM of thalamic, some nuclei of the thalamus. There is a location, there is a nerve cell called VIM in thalamus. So these are the nerve cells which we stimulate by electrical stimulation. So this pacemaker, wire, lead, and a programmer, these 4 things is the system. So next is, what are the equipments required for this surgery? First thing what is required is stereotactic frame. Stereotactic frame is a frame just like a helmet, which is fitted in the patient's head, fixed with the screw and small rods fixed. With that frame, we do CT scan. After the CT scan, there will be a machine called navigation machine. There is a machine called navigation. With the machine, we do planning. In the machine, we select our target where we'll stimulate. We select our trajectory, that means the road. Through the roads, our wire will go to that specific nucleus. Why we select the trajectory? Because the road through which road will go, that road will not contain any vital structure, like will not contain any CSF space, which is called ventricle, will not contain any blood vessels. Injury of those blood vessels can cause hemorrhage. So these are the structures should not come on our way. So that is why we select a safe trajectory to go to that specific nucleus. Now third is operation theater table with a attached frame, anesthesia machine, our surgical instruments to make hole on the head. Each side of the head, there we make hole, small hole. Through that small hole, we introduce the wire into that specific nerve cell by the help of that navigation machine and stereotactic frame that gives us our way and the target. So these are the equipments required for deep brain stimulation. Now the procedure, what we do, the patient who will undergo this operation, deep brain stimulation, on the previous day of surgery, he will need an MRI. Now this MRI is a very special MRI. It is called DBS protocol MRI. DBS protocol MRI, under general anesthesia, patient's MRI is done. That is the specific MRI which is applicable to that navigation machine, and also on that MRI has a different sequences. So we use those sequences where we can see the target very well. So this is a very special MRI, not the routine MRI. So after MRI, we put that MRI CD to that navigation machine, and that machine gives us the target. Depending on that particular neurological disease, we select our target and we see the target, and we select our trajectory, and also we select our entry point. Through that entry point will go. So we select our entry point, and at that entry point we make our hole through which we go to that specific nucleus. So this is the planning. Navigation machine gives us the planning, the entry point, trajectory, and the target. Then we take the patient in the operation theater. This operation is usually awake surgery. Patient remains awake. It is not under general anesthesia. Patient remains awake. Patient talks, patient moves hands and legs, and during implantation, when we put the wire into that specific nuclei of the brain, we stimulate during operation. Electrically stimulate that specific nerve cells during operation, and we see the response, how patient's neurological symptoms are responding. During surgery, patient responds. Suppose a Parkinson's disease where patient's problem is tremor, patient's hand shaking. Once we stimulate that specific nucleus, the shaking stops. So that indicates that we are at the right target. Then we stimulate with increased voltage. During operation, we stimulate, suppose for example 1 volt. We increase the volt, 2 volt, 3 volt, 4 volt, and we see the side effect. That when we increase the volt, whether patient is having side effects. Side effect means whether patient's face is twitching, whether face is twitching, whether eye is deviating to one side or opposite side, whether patient's speech is slurring, getting slurred. So all these side effects we see. Our neurologist, they examine the patient during surgery and see the response, the clinical response and the side effects. So during surgery, by the electrophysiological test, we see the response. We stimulate and see the response. So by electrophysiological test, when we know that we are at the right target, then we fix the electrode there and we connect with the battery or pacemaker, which I showed you. Same procedure we repeat in the opposite side, usually done in both sides. In one patient, it is done in both sides. After operation, patients usually remains awake, and when implantation done, we put the electrode into the specific nuclei of the brain. Then we give sedation, anesthesia, general anesthesia to the patient, and this battery has been placed under general anesthesia that may last for half an hour. General anesthesia, we place the battery. So the operation actually is two-staged operation. There are two stages. One is awake stage, one is asleep stage. In awake stage, we put the electrode into the brain, and in asleep state, we put the battery in front of the chest wall. So that is the two stages of surgery. Now, after surgery, we do again CT scan, and we merge the CT scan with the MRI, preoperative MRI, and we see where is the location of the electrode, and accordingly we stimulate. So after operation, after 2 days or 1 or 2 days of operation, we start the stimulation. We machine the pacemaker machine, we start, and it gives electrical current to that brain specific cells, and when patient symptoms improves gradually. So that is called deep brain stimulation. And after operation, periodically at an interval of 2 weeks, 1 month, 3 months, this pacemaker requires programming. Programming means the voltage, pulse width, frequency we change according to clinical symptoms and according to improvement and also side effects. So every 2 weeks or 3 weeks or 1 month or 3 months, patient requires programming of the pacemaker, during which we change his voltage, pulse width, etc. All these things. So this deep brain stimulation in all crippling neurological diseases, when it becomes completely medically refractory or medicine doesn't respond, then it is a procedure which can give a very good quality of life to those patients who were very disabled. Almost day-to-day lifestyle became very, very disturbed. They start good quality of life. They can start their job, office, family life, everything. Only thing, periodically this pacemaker requires programming. So initially, in first 3 months or 6 months, it requires repeated programming, but after 6 months, it is 6 monthly or yearly once requires programming. The dose of medications in those diseases after deep brain stimulations, it is reduced drastically. They don't require to take much medicine. Some medicine they will require, but not much. So that is called deep brain stimulation. And risk of surgery is very less. It is maybe 1% risk that during implantation there may be a hemorrhage within the brain, but it is a very rarely happens. Another thing, sometimes infection can happen. Infection can happen in the foreign body or in the track of the battery. This can happen very rarely. And sometimes device or the pacemaker what we use, or wires or leads, this device malfunction can happen sometimes. So these are the problems. 1 or 2% problems can happen after deep brain stimulation or during the process of surgery. So this is a wonderful procedure, deep brain stimulation, for those patients with those neurological diseases who are suffering very badly and medicine is not working at some point of time after say 5-6 years of disease in Parkinson's disease, and some diseases no medicine works, like dystonia and essential tremor, no medicine works. So these are the conditions where deep brain stimulation is the mainstay of the treatment. So this is called a deep brain stimulation. So now you can ask me questions who are listening, any specific questions. Everybody has said good evening. Yeah, good evening. So any questions? Yeah, one question I can see that I hear even in heart the pacemakers are installed. These are the same? These are specifically for neuro patients? Yeah. These pacemakers are for heart also. Pacemaker is required for conduction disorders, but these are different pacemakers. These are not same like heart pacemaker. Heart pacemakers are different, but these are brain pacemaker. These are brain pacemakers, which is different, which is used for only neurological diseases. These are not heart pacemakers. These are different. Another question is, once pacemaker install, is it for lifetime or is it for certain duration? Yeah, it is for lifetime, but there are two types of brain pacemakers are available. One is rechargeable, another is non-rechargeable. So this you can see, this is a non-rechargeable pacemaker which is called Activa PC, non-rechargeable. That means this pacemaker battery will last for 3-4 years. After 3-4 years, and that 3 years or 4 years, it depends on at what voltage it is on. If it is on in very high voltage, patients who need very high voltage, their longevity of this pacemaker is less, maybe 2 years. Or when it is on at low voltage, the longevity is higher, maybe 5 years, 6 years. So this is non-rechargeable. There is another battery, this is called Activa RC. This is rechargeable, like a mobile phone. You can recharge. This is for lifetime, but you can recharge it. So at 4 days or 5 days interval or 7 days interval, you have to recharge with a device. So this rechargeable pacemaker, you can say it is for lifetime, but time to time you have to recharge it. So I think that is the answer of this question. So whether it is lifetime or not, yeah, the rechargeable is for lifetime and non-rechargeable is not for lifetime. It requires changing at an interval of some years. So Third question, doctors, you said seizure is one of the indication. Yes, epilepsy. Epilepsy is one of the indications. Then how to identify that this patient has to undergo operation? Yes, when epilepsy is not controlled by medicine, there are some epilepsy which is called difficult to treat epilepsy or medically refractory epilepsy, which is not controlled by medicine. You are taking one medicine, two medicine, three medicines. I have seen people are taking 6 medicines for epilepsy and then also it is not controlled. They are having everyday epileptic attacks. So in those patients, deep brain stimulation might help, but they require few pre-surgical workup whether they are right candidate for epilepsy. So cases are selected. Not all the patients respond to deep brain stimulation. Not all epileptic patient responds to deep brain stimulation. So cases are selected. We have to do some pre-surgical test and select the patient. So that is the answer. Next question is, do brain stimulation helps dementia patients, as my granny is very forgetful these days? No, it doesn't. It doesn't. There is no indication of deep brain stimulation in dementia. So it doesn't help. What cost for placing a pacemaker operations? Yeah. So non-rechargeable pacemaker, the device itself will cost around 7 lakhs. Device itself will cost, and including all the cost, it will come around 9.5 or 10 lakhs. For rechargeable, cost will be more. It is around 12-13 lakhs for rechargeable pacemaker, because the device cost is around 10 lakhs. So that is the cost. What is diet precaution post patient on pacemaker? Any diet. Diet has no relation with this pacemaker. Whatever diet patient was taking before, they will continue to take that. So there is no diet specification. How much time patient needs for complete recovery? In hospital, 10 to 12 days, because we program after the operation, and after that maybe a month, which will be required for recovery from surgery. There will be few stitches. Over the in the head. There will be 2 areas. Few stitches will be there, and in the chest wall where the pacemaker has been implanted, there will be few stitches. So after 2 weeks, we remove the stitches, and overall recovery time is maybe 1 month, maybe a month time. Next question is, precautions should be taken after. Precautions. What precautions should be taken after deep brain stimulation? Nothing specific. We have to do some dressing for the wounds, pacemaker wounds, and in the head. Just every alternate day do some dressings, and no other specific precautions. We give some medicine for the pain, some antibiotic for few days, and previous medicines also go on for some time. So these are nothing specific. Next question is, how does a DVS battery last? I already told that rechargeable battery, it is the lifetime, but it requires repeated charging every week or every 5-6 days. It depends on at what voltage it is on. If it is very high voltage, it is on at very high voltage, frequent charging may be required. If it is on a very low voltage, then 7 days, 10 days is fine. But non-rechargeable batteries, longevity is 3-4 years. Again, depends on at what voltage it is on, but by and large it is 3 to 4 years. Patients with dystonia. You know what is dystonia? I feel you have no much idea. You have no much idea about dystonia. Dystonia is a disease where our muscle tone of the body is disturbed because of primary some problem in the brain. It is the usually it is a genetic problem, but it can happen in secondary disease also. That after meningitis, after brain injury, head injury, after some stroke or hemorrhage, it can happen. Secondary dystonia. So in these cases, patient almost cannot sit properly, cannot. There are bizarre kind of movement of hands and legs. They are almost tossing in the bed. They are almost tossing in the bed. So those patients, they respond very nicely by deep brain stimulation. So in India, not much awareness is there regarding deep brain stimulation, because in developed countries it happens very regularly, but in our country the most important barrier is the cost, because it is a high cost operation. Even in government hospitals, patient has to buy this device, which is called at least 6 to 7 lakhs, because it comes from America. There is no Indian company which prepares this pacemaker, brain pacemaker. So it comes from either America or Canada, and it is very costly. So that is the most important problem in our country we face, that not all the patients we can treat with this procedure. Even they are suffering, but they can't afford this. So if we can do something, we can prepare this device in our country, that will be great, so that we don't have to face this challenge of cost. There is one question in Kolkata, where we can reach for diagnosis, for knowing more about these directions of the pacemaker. Yeah, you can come to our hospital, Institute of Neuroscience Kolkata, INK, what we call Institute of Neuroscience Kolkata. You can come to me or our neurologist. They can tell you about the details of the procedure. We have to see the patients, and we have to see everything, signs, symptoms, his suitability of surgery, his fitness for surgery, and after that we can decide whether he is the right candidate. So Institute of Neuroscience Kolkata, Malik Bazar, Park Street. Yeah. So that is our location. Yes, I think there is no other question, so we can stop here, we can finish here. I think the video will be there, and anybody of you want to reach us, you can call or you can give a message, WhatsApp or SMS in 98301 51497, or you can search Institute of Neuroscience Kolkata in website or Google. You will get our details, Institute of Neuroscience Kolkata. Okay, thank you all for your time and your patience, and good night. See you again, I hope. Okay. Thank you.